So I'm going to start first with the importance of coding accuracy. Now, one of the themes that you'll hear throughout today is the importance of the entire mid-cycle quality programs. But with our first focus being on quality, with coding, it impacts reimbursement, physician and hospital quality profiles, compliance, and denials. And denials in turn can have a negative impact on patient and physician satisfaction. In a 2021 study performed by CMS, which looked at over 1 billion claims, they found that the average denial rate was 12%. However, the denial rate varied by payer, and they found that some payers denied as much as 30% of claims. And I'm sure many of you on here today are seeing similar results. Now, coding accuracy continues to be even more challenging for healthcare providers as new medical therapies, care delivery models, government and payer regulations all continue to evolve and emerge, which adds another layer of complexity. Now, due to this, healthcare organizations need a leading practice approach to coding accuracy. The approach we utilize has 3 levels of defense, or what we also call 3 lines of oversight, to include coding operations, coding quality, and coding compliance. Having 3 separate and distinct lines of defense really allows us to be more flexible and to have the ability to respond to the ever-changing healthcare environment. Now, the coding quality team focuses on individual coders' performance along with patterns and trends, while coding compliance audits from a risk-based perspective. In your program, you will need to incorporate a variety of audits on a routine basis. Random audits are definitely necessary. However, you also need to perform pre-bill and spot checks across the continuum of your patients. Also include focused audits for problem-prone and high-risk areas. The next critical component is, what do you do with these findings? Make sure you have a very strong feedback mechanism, including one-on-one with coders and coding leaders, along with educational sessions for the entire team for identified patterns and trends. Now, the feedback loop actually needs to extend beyond coding operations. You also need to include input from your clinical quality programs, denial management and/or denial prevention teams, CDI, and billing. Engage key stakeholders in discussions of high-level pertinent findings for their area of the organization. Also, make sure you elicit feedback to see where their pain points are. So this will help foster the multidisciplinary collaboration. Now, make sure your quality program also includes audits on your auditors. This is key. They need to be held to a higher standard and accuracy expectation. Your coding quality program is only as strong as your weakest auditor. I'm going to say that point again. Your coding quality program is only as strong as your weakest auditor. Now, of course, I understand that to build a strong quality program may sound costly. However, it will pay for itself with reductions in edits, denials, improved reimbursement, reduced compliance risks, and improved quality profiles. To minimize audit costs for a very manual process, and to have a holistic view of coding quality from all the various internal and external audits, we looked in the industry for an audit technology. However, we couldn't find a vendor with our specific criteria. Therefore, we developed our own proprietary solution. Our technology captures the entire audit process, including the auditor recommendations, rebuttal discussions between the coders and the auditors, the final outcomes and agreed upon revisions, scoring on each individual coder, and it also includes the status of the rebuild process. We wanted and needed the ability to capture critical data elements for root cause analysis and reporting at both a granular and a high level. Now, our audit technology coupled with business intelligence provides patterns and trends for education, training, accountability, and accountability, of course, is key, and decision making. We have found that our 3 levels of defense approach for coding quality coupled with our audit technology to be very successful. And I will share outcomes from a case study for coding and clinical documentation integrity in just a minute.